Well, hello everybody. I'm glad you could join us tonight. Tonight we're going to have some short little videos that we've recorded over time. We're going to be talking about the COVID-19 and pneumonia. Also going to be dealing with people with eyes and what's happened there. Rotator cuff, and also talking about pets. Everybody has a beloved pet, and I know a good friend of mine, he just lost one of their family pets, and obviously the whole family is heartbroken for quite some time until they got a brand new puppy. So, anyways, pets can be a real great companion, and our light technology has been able to help with that too. So we got some neat stuff. So I will now. I just want to mention as well, we have a Palm Ultimate that for all of you who are watching us tonight, you'll be entered in as a ballot. And then at the end of the month, we will draw a name, and the following month we'll let you know who has won one of the Palm Ultimates. That's a $1,300 device, and it works extremely well. And somebody who joins us more often probably has a better chance of winning. So that being said, we will also be giving a think about it, your friends, those you want to invite, those that you share a link with. That's coming up. You'll be able to share a link with your friends, and what will happen is if they respond back with a favorable yes, they'd like to join in, you will also be entered in to this giveaway for a Super Palm. That's the device with the 660 1050 nanometer wavelength, and with those two wavelengths, beautiful stuff. And that's a $1,900 device, and that comes if you have the most. You get it free. It comes with the if you have the most number of people that sign up to our webcast or webcast to our subscription list. So just start thinking about that, because that will commence in the next, I believe, the next week. So you got two different ways. One way you can win, and the other way is a little extra work in that trying to reach out to some of your friends and tell them about us. And please remember to subscribe to. We do have a YouTube channel, and subscribe to it to keep updated. And also love to have you put the like if you like our videos, and we'll go from there. But anyways, now we're going to start with our intro video. 15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your fingers, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere. and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs. Well, so tonight, for those that just came on, we'll be talking about some things with COVID-19, how we've been able to see help with light therapy that way, and pneumonia, and eyes, how you can help improve the health of your eyes, rotator cuff injury, and pet health. So we're going to start now with the collection of short videos that we have. So I got a chance to get interviewed by Neil Boron, really neat guy, and I was able to see how we were able to help him in his situation. He was in rough shape because I knew him for quite some time, and I reached out to him and said, you got to use one of our lights for your lungs, because his blood oxygen was sitting at around 80% and not doing very well that way. And very quickly he was able to turn around and get better by using the palm light on his lungs front and back. So
welcome to NBL. My name's Neil, of course. Zach Man over there on the other side of the glass. Tom Kerber of Kerber USA is with us, and we're talking about light therapy. It's taking certain wavelengths on the electromagnetic spectrum.
Good, you got that.
Yeah, I'm an expert now, and using those, very similar to a woman singing a particular note, and you watch the champagne glass break, using just the right wavelength of light to be able to reduce pain and swelling and promote healing in the human body. Okay, so I believe it was the spring of 2001. I'm sorry, it was Christmas Eve 2020, Zach, is that right? When you gave me okay,
nice son.
Yeah, he comes over on Christmas Eve. He says, I don't feel well,
and gives you.
Yeah, by the day after Christmas, by the 26th, I wasn't feeling well, and I didn't for like 5-6 weeks. I mean, it was bad. So I got hit with. You had at the same time,
correct?
And somehow you found out but you had the advantage of using light therapy to help you. So you had a unit sent to me. And now, please understand, I could breathe. I could take a deep breath, but I wasn't getting anything out of it. So you put that little thing on your finger, the pulse ox thing, and it was reading like 79 to 82.
Yep.
Oxygen saturation in my blood. It's supposed to be like 98, 99, 100. It was 79 to 82-ish. And Mary actually called the ambulance a couple times because I was struggling. And I never went to the hospital. They begged me not to go to the hospital. Please don't go to the hospital. You'll sit in the hallway. Nobody's going to help you. If you can manage it at home, if you can stay here, hang on, brother. And so they got me some oxygen tanks, some breathing all this, oxygen. And when I finally got the unit you sent me, I started using it, and I used it on the setting that penetrates the human body. There's one setting that's more like for your skin.
More superficial. It's still very good, but that's 660 nanometer, yeah.
And the other one, which is not as bright, but it penetrates the skin.
Correct.
It goes deep into the body and does something to the cells, because then the cells begin to kind of come to life again and work better. And in a matter of a day and a half, I began to see the numbers going up. And in a matter of 2 weeks, I was at 100.
Yeah. And see, I was
unbelievable.
I was the precursor to that, because I had measured my blood oxygen. It was 80%. I was in such bad shape with my brain as well. I wasn't thinking clearly, and my son took me into the hospital, and he knew something was really crazy about Dad. Dad's normally crazy, but in this case, I'm over the top. And he took me in, and they said, and I had a really bad. I had my blood oxygen going in, but it was 80. And then they did X-rays on my lungs, and they said, you have a really bad double lung pneumonia. And I'm really glad they decided to kick me out of the hospital, because I was able to immediately go home. They said, "Here, hope you get better. Here's a script for some antibiotics," which probably would have taken me out at that point. But anyways, I started using the light right away every day. And every time I did, my blood oxygen started increasing. And so after about 2 weeks, I had improved quite a bit. As a matter of fact, 2.5 weeks, I started coughing so bad. I thought I was going maybe downhill again. So I went and went to the hospital, emerged, asked for another set of x-rays on my lungs. And in the end, they said, no, nothing. Your blood is good. Your heart is good, but your lungs are exceptional.
What happened to those lungs?
And they're comparing x-rays, and they can't believe it. And that's when I happened to hear you or hear your son mention something, and I thought, I've gotten better.
I was out of work for several weeks.
And I've gotten better. I got to call you. And so that's when I did.
I don't know if you remember, but you called me at one point when your brain was foggy, and we had a long conversation. I was finishing sentences for you. You really were struggling with that mental part of the whole thing.
Oh, I was.
And at one point, because I affectionately kind of consider you like the professor on Back to the Future. 1.21 gigawatts. That's who Tom is.
I had severe. I had double lung pneumonia, and I was in bad shape. My blood oxygen was 80%. I was not thinking clearly, and I was going through a lot of the things that same as chemo brain, as far as I couldn't think clearly. I couldn't. My whole life as an engineer and designer is looking at a page of numbers and seeing the graph before you even plot it. And I couldn't even add 3 numbers together if I tried. Took me a whole day to process and complete a simple quotation. I was so mentally challenged. And one of the researchers and medical doctors in West Virginia at the PBM Foundation, when I was talking to him, he says, "Tom, what are you doing? You're treating your lungs, and you're seeing." I was using this device here for treating my lungs, so I very quickly improved my lung conditions. As a matter of fact, in 2.5 weeks, my lungs, my second set of X-rays showed that my lungs were phenomenally improved over 2.5 weeks by using this guy behind me 3 times a day, front and back. And I was treating my lungs, but I still couldn't think properly. I couldn't process things properly. I've got 99% of it back, so I'm very thankful on the processing part. Once in a while, I'll screw up. But he says, "What are you doing for treating your brain with the PBM?" And it was like my brain was not processing to think that I should be using the light on my brain. And so immediately
I can totally relate to that. Yeah.
So I immediately started treating myself first with this, and it was shortly thereafter that I developed the helmet, because I thought, I want my brain back. And so I used the helmet as well, and so I was able to see myself pretty much fully recovered. I don't know, if you ask my wife, she might still think I'm a little deficient in certain areas.
So tell me a little bit about your situation. We both ended up with pretty much the same time, and I had just finished improving very quickly with using the mini canopy, so shooting a large area of my lungs front and back. My blood oxygen going into this was 80%, and I had significant deterioration of my lungs, compromised lungs, and the x-ray showed that I had double lung pneumonia. And so it was at that time, January of 2021, I started using the light front and back as soon as I was discharged from the hospital. Thankfully, I was only at the hospital for a few hours, maybe 8 hours, I think. But then I could start using the light at home, and I did. And that's when I heard on the air something about you having, and that you weren't doing so great. So since we had connected with each other a few times, I reached out to you. So,
and thank you for doing that. Yeah, I made it through 2020 without, getting, but I guess it was at the end of 2020. Christmas Eve, we had the family over. My son Zach said he didn't feel well, so he was sitting off to the side of the room near an open window, just trying to not get anybody infected with whatever he had. Turns out he had, and he gave it to my wife and I, Mary and I. So, you know, we got sick maybe the day after Christmas or so. You know, just all of a sudden got whacked with for the next really 2 weeks. You know, just trying to cope with all that. I think my wife got better more quickly than I did, but it was the lung issue because, you know, all the aches and pains and the fever and all that stuff. It took, you know, 7 to 10 days for me to get past most of that. But what was happening was when I would breathe, I wasn't getting any benefit out of the breath. My, you know, oxygen content in my blood was somewhere between 79 and 82, which was shockingly low.
Yeah.
So
it's a very bad level.
Actually called, you know, for an ambulance on 3 different occasions. Each time they talked us out of that simply because of the state of the hospitals wasn't good. I mean, you were going to go to the hospital and sit in a hallway for 4 days before anybody would even see you. And they said, as long as he's not delirious and as long as he's, you know, stable, like, treat him at home. Just do what you can to take care of him here. And somewhere in there, you heard about my situation.
Yeah.
I think it was that my son, who also works, Zach works at WBCX. I think he mentioned it on the air. I'm pretty sure that's how it happened. You heard about it. You then had someone over in States bring me one of your units, kind of a palm-sized, what you call it, but yeah, one of those.
One of these guys here.
Yeah. So, you know, the one setting deals with more topical kind of stuff.
Yeah, this is the red, and this is the near infrared wavelength there, and that's the one that Neil would have been using. It's the dim setting.
Right.
Yeah.
But it penetrates.
Yeah.
So I was putting it on both sides of my chest, and then my wife Mary would put it on both sides of my back to be able to get to the lungs as best as possible. So, you know, 30, 40 minutes a day, several times a day, I was doing that. And what happened was that I wasn't improving for a period of time till I got that unit. Once I started using it, the improvement was almost instantaneous. Now, I didn't all of a sudden have 99 to 100 oxygen content. It took a period of time, but every day you could see it inching up. And so I was out of the 70s into the low 80s, then the mid 80s, and then the upper 80s, and that was pretty encouraging. And in a matter of about 3 weeks, I was back into the mid to upper 90s. And, you know, I'm just so grateful that I had the opportunity to even know about it or use that, because I don't know what would have happened long term. I wasn't improving. I was out of work for the entire month of January that year. So we were sick at the same time.
Yeah, exactly.
But you were helping take care of me, and I didn't know what I could do for you except pray. But,
which is perfect.
Yeah, but we both got better. But I credit my turnaround to the use of light therapy. It was incredible.
Boy, looking back at memories, I don't know if you noticed in that second video where I had the interview by the one woman, my brain was really fried still. It still wasn't 100%, but it was still a whole lot better than it was. So I was still making progress, but I think you could tell in that video what it was like, what I was dealing with. But that you only saw a small fraction of where I was. But I seriously believe that it was the mini canopy, the one that you saw in the one video, that ended up helping my lungs significantly improve. And so the 810 nanometer has that possibility of going much, much deeper. So anyways, I'm here because I believe the very light that God created, and I used just a little bit of it go into my lungs, and it helped me big time. So hey, I'm thankful for light and how it helped me. So next we're going to be talking about wellness for eyes, and here we go.
If somebody was using it for some kind of want to help the wellness of their eye, they'd be looking at using about 1 minute to 2 minutes. And I would say if you want to use the 660 nanometer wavelength, with both situations with the eyes closed, you would keep that pretty short treatment of 1 minute. And if also it'd be great if you would be able to take 1 minute of the 660 nanometer and 1 minute of the 810. Now this 660, it is pretty bright, so you can actually pull it further back just to a comfortable level, but again, with the eyelids closed. The power level at that point coming from the unit is less than that from the sun. So, and it's a very short treatment, so.
Yeah, so when it comes to the eyes, it's very important. Close your eyelids, okay? And the reason being is the eyelids will diffuse the light that comes in. And it's only a 1 minute treatment with the red and 1 minute with the near infrared. And that can help with the wellness of eyes. We've been able to see a number of different challenges be improved. So at some point in time, we hope that we will have some individuals out there that are in the research world that can start a study on using light on the eyes. But there is a piece of equipment that has been finally approved by the FDA. And that is, and I doubt whether there's too many of them across the whole US, but it's a light that would be used in an ophthalmologist's office or optometrist's office, and it's for dry macular degeneration, and it can help with that. We've been able to see improvements with closed eyes, 1 minute of the red, 1 minute of the near infrared. And now I just want to mention too, I'm not a doctor. I'm just saying what we've seen out there, and you have to make your own decisions and check it out with your specialist. So next we're going to talk about a rotator cuff.
My wife fell and tore her left rotator cuff, and she only had 60% range of motion, getting monthly cortisone shots, deep pain. And one of the attendees from that optical side of America gave me a PBM device and said, have her try it out. So for about 4 weeks, she was putting it on her left shoulder, 3 different places, about 4 minutes each place. And after the fourth week, 100% range of motion and no more cortisone shots. So that made me a believer immediately.
And then your wife has also had a chance to give it a try for...
Yeah, she's had trouble with her right shoulder and has experienced, pain and lack of movement and that kind of thing. And she's been able to use it on her right shoulder, and it's provided quite a bit of relief, pain relief, and also greater mobility. So, we're grateful for that. I don't know what kind of pain or swelling, she really has. She's been to physical therapy, but no one's ever diagnosed that she has a partially torn, rotator cuff or anything. She has no official diagnosis except that she has pain and lack of mobility in her shoulder, but it's been used to really help loosen up that situation.
And get the mobility back.
Yeah.
Yeah.
So, yeah, I'm a firm believer that there's value in light therapy.
We're going to get into pets in a minute here, but I just wanted to mention, please feel free to put your questions in the chat. And if we don't get through to them all tonight, we will try our best in the next day or two to answer them. So one question that did come up is about the helmet. The helmet, which I'll talk to you about in a few minutes, that's this device here. With this SunPower LED helmet, we have two different versions of this. We have a version that's 660, 810. That's our regular our regular helmet. And then, so we just have the, you can see the 660 red wavelength here right now. And you can also see the 810 in there. You just see some little dots over here and here. This is the 810 version. And you can't see that very bright, but actually that's the wavelength that can actually penetrate much deeper, much deeper than the red. So we do have on our devices, we do have the option if somebody wants to get it, the ability to plug in a pulsar unit that allows you to, if you do want to get into treatment using the helmet with various frequencies, you can set that little pulsar for whatever frequency you want. So if you wanted 40 hertz for brain stimulation and other things, you can just type in, you just push the button until you hit 40. If you felt that you have somebody who's slightly off, I'm just kidding. You could use 39 hertz. 40 is supposed to be the frequency that can make a difference on that front. And 10 hertz is more of a calming frequency. And so you basically can set any frequency easily between 5 hertz and 500, no issues. And you can set how intense the pulse is. So it's pretty easy to use. So you don't have to get the pulsar with it. You can just get the straight unit. But if you want to add that to the order, or get something like that with your shipment, no problem. Just put it into the order. So now what we're going to go into is on talking about pet health. So here we go.
Yeah, well, another great reality check is in the veterinary world, because animals don't understand placebo effect. A lot of people say, well, you put a light on you, there's a placebo effect. Well, animals don't understand placebo effect. So most veterinarians now in America are using red light in some way, shape, or manner. And we now are down to 2 cats and 1 dog, but we used to have up to 6 cats, and they all lived good long lives, up to 19 or 20. And those final couple of years, they started getting arthritis, and we put on the red light, and they completely moved about perfectly. And right now we're using it on our dog, who's just turned 13, a beautiful red heeler. And she's, even just after 2 days of treatment, and this last week we started, she's no more stiffness, running up and down the stairs like she did a couple of years ago. So if one doubts PBM, look at the veterinary world, because again, animals don't understand placebo effect. Either they move better or they don't.
Yeah.
And I said almost every major mainstream veterinary clinic in America now has some form of red light device that they're using, because we all know that when you have hip dysplasia or any kind of severe arthritis, that's usually what ends the life of effective life of an animal. They're in pain, they cannot eat properly, they can't move properly. And in the case of cats as well, renal failure drew them in, because how small cats are. PBM light is resolving the renal failure issue as well. So, we have this wonderful veterinarian up in Boston who goes around to all the veterinary schools every year and teaches the upcoming veterinarians how red light can be part of the process here. So it's another amazing reality check that this device is really an important part of our health environment.
I had one of the individuals, he had a cat that was, I think it was 14 or 15 years old, and was now relegated to only one room in the house, in the living room, and that was it, because they couldn't move around without pain, and so where this cat used to be a tomcat being out there in the neighborhood. And so he got one of the mini canopies, this big one, and he used it over the cat. First, the cat was a little sheepish, uncertain about the noise and everything. Didn't take long that he would turn on the light and the cat would come running off their comfortable bed, soft bed, and lay underneath the light, to the point where the cat started snarling at him if he shut it off. And the cat went from being secluded to one room to starting to explore other rooms in the same level, started climbing the stairs, to doing upstairs, downstairs, basement, to starting to roam the neighborhood again. So
that's what it's all about. Yeah, it's incredible.
Total change around for that cat. I had there's lots of dog lovers out there, and the ability of light to help an animal is really something else.
Yeah,
and
absolutely.
One of the people that I knew, they had done light therapy for other types of treatment for themselves. And they came in there, they said, looks like our dog we're going to have to put our big lab down, because wintertime, during the winter, it had taken off across the ice to chase a squirrel, and didn't have traction control in place. And ended up wiping out against the far side some kind of bricks that were up on the thing, and severely hurt its rear end area, hip area. And so they were at they had in their house, they had to immediately go up some steps, so they were lifting the animal from the rear up so it could go up the stairs, and they were seriously considering putting the animal down. And they got one of my lights, and they immediately started treating, and it wasn't too long, and that dog had made 100% recovery and was back to chasing squirrels. Maybe learned something from the ice capade, but really made a difference that way.
Yeah.
So
I mean, again, Ron Hirschberg, who's the vet in Boston, I mean, he does very detailed clinical studies and case studies, and he's averaging up to at least 2 years additional quality life in the animals he's treating. And for those of us, I mean, we probably say I love you to our animals more than to our spouses, and so we know how integral they are to our lives. So to know that a loved animal can be with us maybe 2 more years because of red light or PBM treatments, that's huge. That's huge.
So I want to tell just the first story right off the bat. So the fellow Alan Crow, who was going to speak tonight about his cat was older, 15 years old, and it used to prowl the neighborhood, and then would go throughout the house, but no longer go out in the neighborhood. And then as it got older, it ended up having pain in that, and so it was down to one room in the house, and it wouldn't go into any other rooms or go down in the basement or up the stairs. He started using the panel light. That's the one that's about there we go, about a foot square. How's that? Everything's a little backwards when you're trying to do this. So anyways, foot square. So first time he turned on the light, the cat wasn't too excited about the light being on, and he tried to encourage the cat to be under the light. Second time, it was a little less effort. Third time, he turned on the light, and the cat came under the light. And after that, as soon as he turned on the light, the cat would leave its comfy bed to lay on a hardwood floor and get the light treatment. And as he did that, he noticed that the cat started now going through the house, and then it started doing the stairs, up and down the stairs. And not only doing that, then started even going out and prowling the neighborhood. So that's how confident the cat was able to get, because it now was able to move and move well. And he did say one funny thing was that that when he would reach over to turn off the light, the cat would actually snarl at him. So anyway.
So the one that you're going to see is my assistant. She had a big dog, and he had happy tooth syndrome, and he was banging his thing. So she spent a long time going to doctors, a lot of money, and then she finally said, I'm going to take the SPP. We call it the SPP, the white one, the little palm unit.
Okay.
And so we call it the SPP because I have to abbreviate it somehow in my notes. So she came and got that and took it home, and within 2 days, she knew there was a difference. And she'll tell you all about it.
1 second here. Jim, do you think you can find that picture and pop it up if you can on a share screen if it works? We'll try that. In the meantime, we'll talk about some of the stuff that continue. So we'll show
and so I have used photobiomodulation therapy a lot. She uses it on patients, but she'd never really used it on herself, her family, or herself or her dogs. So when it wasn't working conventionally, she sheepishly says, "Can I borrow it?" I go, "Yes, take it home. It's okay." So she took it home and she used it for about 2 weeks, and it was fully healed, and it's never come a problem again. And she'll tell you in her own words. It's really well done, I thought. And then my other employee is a hygienist who does German Shepherd rescue. And I wanted her to speak because she's got tons of knowledge, but she was unable to figure out what to do. So anyway, she borrowed my photobiomodulation unit and took it home and used it on a dog that was older, that couldn't walk anymore, couldn't get up to go to the bathroom, just wasn't able, but she still thought it had some spunk in him. So she used it on him. And that dog got up and was able to go to the bathroom outside for another 6 months. And that made her really happy. Another one of her dogs was a big shepherd and was the love of her life. And she goes, "I'm not ready to put him down yet." So she used it. He couldn't walk anymore or jump in the back of the pickup to be taken places. And so she started using the light on his spine. And she just kept it up, used it on his spine. And in about a week, he was able to walk. And in about a month, he could leap up in the truck. And he did very well for another almost a year of doing that. And she used to borrow it once or twice a month from me. And then she'd use it on him. And she says it just kept him going and he learned to like it. So those are the two pet ones I've really got great knowledge on. And a couple of my patients do seeing eye dogs, and they've used it on their dogs with injuries. And my daughter, he's used it on our dog. We didn't take pictures. Our dog on his nose. He puts his nose under the fence and it always gets sore. She puts it on there and it gets better. So that's really been helpful.
And right now we're going to bring Brad Little on. Brad, there we go.
Evening, Tom, and everybody.
I'm in Florida on the ground, and Brad is in the air.
Can you hear me okay?
Yes, we can. Yes, wonderful. We can. So tell us your story that you're aware of.
Yeah, and it's not a direct story in that it didn't happen to one of our dogs. We had 3 little dogs. But it is another tale of the tail in some ways. We walk a couple of our dogs around the neighborhood. And there's another couple, a couple who walk their little dog, about 8-year-old Shih Tzu, by the name of Bailey, a very friendly little dog. And about 3 weeks ago, it was attacked by a German Shepherd, and fortunately, it wasn't really a vicious attack, but Bailey had his winter coat on still, and the vet said if he didn't have it on, he probably would have been dead. So it was a bad enough attack, and Bailey was cut, traumatized. There was nerve damage. He lost bowel movement, and he couldn't lift or wag his tail. And he also cried out when he pooped afterwards, and he had to squat to pee. And so it's pretty severe. And the plan was to send him to a veterinary neurologist. And so we found out about that, the same day or maybe the day after about it. And we immediately lent them, the couple, our Super Palm 1050 for Bailey. And he'd been using it, 2 or 3 times a day, 20 minutes or whatever. We don't know exactly. And on the first day after the injury, Bailey, he's feeling sorry for himself apparently, and would stop at all the houses he knew to get petted, and so people could sympathize with him. And he doesn't do that anymore. He realizes he's better, but one day after the treatment started, there was some tail movement, and within a couple days after the treatment, Bailey was walking much better and now walks normal. And 3 days after the treatment, his owner said he could lift his tail up much higher, and the tail is now 90% better, and there might be some permanent damage, but he's basically back to being his old self, and with hopefully very little permanent damage. And we can't prove anything, but we are fully believe that it's due to the light that he's recovered this well and this quickly.
Well, that's pretty neat. Oh, I wanted to mention too that I just spoke to a fellow from Sweden who's with horses, and that was just about 2 hours ago. And he's extremely pleased because one of his horses had a number of areas that were very painful to the horse. He was able to, if he would palpate that area, the horse would be in pain. So that was, he was able to help this horse get rid of all these pain areas that he was able to do that with using the 1050 nanometer on the horse, even though the injuries were actually deeper in the horse's muscle tissue. It was able to reach into that tissue and help that. So that was pretty neat to see.
Can it be used on pets? Yes, we have pets. We have seen a lot of pets help with this. As a matter of fact, a couple of them would have been put down because of the pain, and because the owners of the pet just saw how difficult the pets were doing.
So tonight we also have another special guest. His name is Alfred. There he comes. So I'll show you Alfred in just a bit, but thank you to Alfred for giving his life for science. I don't know the background, but I do know that that he had I guess done that, and so a dentist that I'm working with was able to well, actually he's retired and decided to give me his skull here. So I'll show you some really neat things in a minute, but we'll just slide that to the side for a moment. Okay, so many I just set something up here. What I have is a sensor. And I did this a couple of weeks ago. And what I'm going to show you is light measurements that are coming on this thing. Yep. So I'm just going to put my glasses on here for a sec. So I've had many people ask me, what about light going through the skull? So what we can do here is I want to show you a demonstration of measurement of light going through first my hand. Just wanted to show you that. And then I'm going to show you the helmet. Okay, so what I've done is I've got this sensor that as I get closer and closer to the light that's shining on my face here, you see the numbers go up, okay? And you see the bar graph on the bottom go up, okay? So if I've locked in the scale to make it a little easier to watch this, what happens. So as I bring my red light up, you can see that the keeps going, and I'm quite a ways away from the light. I could make it auto range, so you could keep getting higher levels, but that's not what I want to do right now. Now you'll notice in this corner, right here. Oh, sorry, it's a little, so you see that it's right now, it's kind of hard to show, but I'll show, there we go, 660 nanometer. That's the wavelength coming out of this device here right now. So what I'm going to do is I'm going to put my hand right over top of this. Okay, so I'm going to show you what I'm going to do. I'm going to put this unit right here, and on this black foam, it absorbs any light that bounces around. Okay, now you can see that the light coming in is hitting the sensor, and that's what I've got. Now, if I put my hand on top of it, it's gone down to 0. Okay. If I go to 660 nanometer, for those who are taking notes, take note, it's 0.11, well, it was there, 0.10. Anyways, that's milliwatts, or also 110 microwatts. From now on, I'm going to use just one number, and that's the number of microwatts, okay? Converting whatever the screen is, okay? Now, if I switch this one to 810 nanometer, what I have to do is, just one second, I have to switch the scales on the unit, and I'll show you in a minute why. Because this unit is very accurate and needs to be told what wavelength is coming into it. So when I switch it now to 810, you can see that I'm now up to, down here, I was at 125 microwatts, and now I'm at 1,100. So the number right now is not super accurate, so we need to change the number. So that's what we're going to do. We're going to change it to 810 nanometer on the scale. There you go. So remember, we had 1,100. So that was an incorrect number, as I said. It wasn't calibrated. But in this case, we're looking at about 750. So we had 110 at 660, and we got 750 around there right now on right now coming in through my hand. Okay, and so 110 to 750 is almost 7 times. Okay, the amount of energy that's getting through at the 810. Now what I'm going to do is get the other light here, and we're going to switch this now to 1050 nanometer. Okay, now this is the Super Palm. It's 1050. I don't even see these lights, totally invisible. This is our best unit, and I'm just going to move this just a hair more over. There you go. And you can see in the bottom corner here, 1050 nanometer, because that's what we have to set it to. Now we're going to set this up here. And in this case, we're around 730, 720. So very, very close is the amount of energy that's getting through this particular part of my hand. Now that can vary depending on the tissue that it's going through. So bone is a little different, but similar. Like, bone is a little different than going through sinews and bone and blood and everything else. So that just gives you an idea. You saw that it was almost 7 times the amount going through at the 810 than the 660, and very similar to that around the 7 times mark for the 1050 than the 660. So that's just one part of my hand. But now what we're going to do is we're going to bring in our friend here, Alfred. Now, this happens to be, as I mentioned, a real human skull. I've got to add his teeth. When I got him in the box, I guess in shipping, a few teeth fell out. The poor guy. Anyways, we will put him back in there for him. But so this is the skull, and what's really cool about this thing is you can see the sutures that bind these areas together. And apparently, now I'm not knowledgeable enough, but I understand that these skull plates actually, when the person's alive, they actually move a little bit. So what happens is in your brain, your brain actually gets a little bigger and a little smaller, just a very, very small amount, which helps pump the spinal fluid up and down your spine from that little bit of movement in the skull itself. So those areas actually are places that are supposed to be able to move just a little bit. And so what I'm going to do here is I'm going to put Alfred's top on top of here, okay? And because I got this kind of foamy material around the bottom, you can't fully see it. It totally seals the light from coming in from the sides. So now what we're going to do is we're going to take the 660 nanometer light. I'm going to take this one here. So remember, many people have said light doesn't penetrate very far, and some have even said, no way can it penetrate the skull. But you are going to see a live skull here. Or sorry, not a live skull, a real skull. He hasn't started talking to me yet, so he's okay. Maybe if I give him enough light treatment, he'll start. Anyways, so what I want to show you is I'm going to take this is our ultimate, and I'm going to put it on the red right now. And this is 660 nanometer. And for those, okay, so we got 0.883 coming, okay, so 0.9 milliwatts or 900 microwatts. So I'm going to say 900 microwatts, okay? All right. Now I'm going to go with the 810 nanometer. Okay, just for a sec, leave it back here. So this is still the setting that we just had. I just wanted to show you because it's so neat to see this. I'm going to switch it right now to the 810. Now remember, it's not calibrated. I got to change something. Sorry, with this measurement, I got to change something. I got to put it on automatic range setting. There we go. So we're going to go up. There we go. All right. There. Okay. So back to my test here. I just moved the setting. So here we go. It's a little hard to see because of the light coming through, but you got around 900 microwatts. Okay. I'm going to now switch it to the 810 nanometer. And you got 6,780 microwatts coming in. So just below one here, or 1,000. And here you got 6,700, 6,800 microwatts. So that's an easy math. That would be 6.8, but the challenge is, as I mentioned again, you have to adjust the meter. So we're just going to adjust the meter here to the other wavelength of
Turned off auto.
Okay. No, you got to have auto on or sorry.
Range.
Yeah, do auto. Yeah, auto or fixed. Yeah, okay. All right. All right. So here we go again. So remember there was the 660. Okay, now because I recalibrated, you just have to remember the 1,000 mark, 1,000 microwatts. And now the real reading is 4,200 microwatts, which means 4.2 times more energy is coming through that skull with the 810 nanometer. When you combine that with skin and the flesh that would be on top and into the brain cells, it can be much, much higher than this, but we're just looking at the bones right now. So if we go now to you just saw it at 1 second here. Okay, you saw it at around the 4.2 mark there on the top of the skull. Okay. Now what we're going to do is recalibrate this for the 1050. And what you're going to see is a very similar reading. And now longer wavelength is supposed to penetrate deeper. And it all depends on the tissue you're going through. Now, we don't have the, flesh on top of this, and there's no blood going through. But what I can do is I can show you right now. There you go. So it's just around, 3.9. So slightly less than the 4.2, but I've just calibrated this very accurately because that's how this thing is set up. So we know that, in this case, with this skull, and maybe it would be a little different if we had a different thickness of skull, like somebody's head like mine who has a thick skull sometimes. Anyways, I thought you'd find that very interesting as far as how light can penetrate through the skull. And I'll just show you another way of seeing it. Is I'm going to just, for a moment here, I'm just going to turn off my light here, just so you can see it a little easier. Oh, so this is, as you can see, this is the inside of the skull. Look at the light coming through there. Okay, and anywhere where I'm sliding the light, it's going through the skull. Same, reverse is obviously the same thing, because if you reverse it, you can see the thicker parts of this bone and everything going right up. It's starting to flood the camera with the intensity that it has. You can look at how you can see even the suture mark along the skull. Pretty neat, pretty fascinating. So light of the different wavelengths, especially when it's longer, like 810 or 1050, does penetrate better. And that's very key to being able to reach deep parts of the body. And we've been able to help with our palm lights, with using palm lights for sciatic hip pain, and have had improvements with that. So, this is something like you got to have the right equipment. And I just want to show you here. It still doesn't give you an idea when it comes to a panel. Oh, I guess it does in some ways. If I took, this is actually one more, I'll add one more demonstration. So this is the red. Let's get the meter back in here. I'm going to go 810. I'm going to go with the 810, okay?
67.
810. Okay. So the fellow that's helping me, you can see down in this bottom corner, it's set for 810. Now, 810 is the light that's going to penetrate a little deeper. I'm going to take I'm going to compare it to one of these panels. Now, these things can get a lot bigger, but I just want to show you what happens to light penetration. So remember, right now we're just getting ambient room light. And if I put my hand on top of it, you see it drops way down to 12 very low in microwatts, right? Okay, I take my 810, and there you go. You see it go right up to around 700 here. Okay, the 700 mark. Okay, now I'm going to take one of these panels that they do talk in some of these things. They talk about how deep it penetrates. It may look impressive, but you're supposed to remember I had a reading of 700. There's a reading of 60. Even if I bring it up closer and closer, it's still 88. Okay, oops. And that reason there is some bright red on there is because because it's a mixed light. And now I'm going to take this one and see, I'm up to the 700 microwatt level compared to the 60 that you just saw there just a minute ago. So, some of these things may look fantastic. They may be very, very low price. You get what you get. our device is really, we're trying to make a difference. We're not trying to just go after skin conditions. We're trying to go in deep. So that's the difference, that there is between the different wavelengths. And hopefully my demonstration here has helped some people understand this. And by the way, to a fellow by name F.A. Guy, thank you for your questions. I am going to look at measurement through hair. I'm going to do that, and I'm not sure if my timing is going to allow me to do it in the next little while, but I'm hoping within the next month I should have some evidence of what kind of losses you get through hair. But the idea being behind the helmet is you're getting a significant amount of light continuously over the whole area. And I've even had some information passed to me that apparently if the hair is wet, it can penetrate a little bit deeper. So hopefully that helps. Okay. Somebody mentioned about can the palm be used? Elizabeth, thank you for your question. Can you use the palm device on your eyes with a cataract? Would it slow the growth? We can tell you that it's helped with some people out there with different things with the eyes. Yeah, it helps with the wellness. I have to watch how deep I go into those things, what we've learned. But yeah, so there's another question by Roman. Thank you, Roman, for joining us tonight. What is the power density and distance away from the chest was the light on? When I used the mini canopy, I had about 1 inch to 2 inches away. And that light level is around 100 milliwatts per square centimeter. At that point, that's very similar to the palm. So the palm device has between 100 and 180 milliwatts per square centimeter, depending on the model. And that's just used right against the chest, right against the skin. Sorry. And another thing to note is that this is not to penetrate through clothing. You lose too much in the clothing. So you want to be able to put that onto the skin. And the other thing is we have built this unit. You see those bumps on there? That's to allow for some airflow. So that, like convection, just to help take away the heat that's would normally build up. We don't want to have heat build up inside. Even though we got a very high amount of light energy, we want to keep the skin temperature warm or just slightly above warm. But that's why we have the light like this. If you have darker skin, you want to move it around a little bit more because you may find it getting a little warm and extra warm because there's a little bit more light absorbed in the melon on people with dark skin. So take that into account. And it's very interesting. Even people with other shades of skin also can have a high absorption. There's a certain meter that's called the Patrick scale, and it allows you to measure how much absorption of light would be in that, because of the skin color. So it's actually something for skin color. So the question is, what about dry eyes? Elizabeth, as a matter of fact, we've seen some people that we know of people that have had improvement in their tear ducts working properly. Yeah, and another question here from Nina is asking about, can this device work for a sprained ankle or elbow? Absolutely. It's really neat to see how fast you can shrink that inflamed area. So the inflammation comes down, and the other thing is you can turn around and see that the healing take place. And I do know one of the doctors who would that I'm working with routinely would roll her foot. I know what that's about, and it can be very painful just by going on a bit of an uneven surface, and all of a sudden tilting sideways, and she did that, and she sprained that area ankle pretty bad. And she said normally after that event she'd be on crutches for like 2 weeks or so. And she said immediately she used the light on the area, and not only did it reduce the inflammation, but it also allowed her to, even the next day, to start putting pressure on that foot without the crutches. So, it really helps then in speeding up the healing. And I thank you for all the questions that are coming in. Wow. I won't be able to answer all these questions, but I'll try my best the next few minutes. So if you want to hang in there a little bit longer, you'll hear some of these answers. Otherwise, we won't take you out of not staying to the end because we are over time right now. So next question, can you share any experience with narcolepsy? I wished I could, Geraldine. I don't know. I know what it is about. A long time ago, I knew that it was something that was challenging for me. Thankfully, I grew out of it pretty much, so don't have that issue. But as far as we have been able to see people improve other cognitive stuff that helps. Like one of the things is the ability to fall asleep at night, insomnia, and that. People have seen significant improvement by using the light. And there's other things you can do. You can go to one of my webcasts that I have, and we get into that with light therapy being used for melatonin and what you should do for that. So if you go back, we have many of our webinars that almost all of them, all of our webinars are posted. You can scroll back and see between doctors and researchers and lay people and chiropractors and physiotherapists. I've had them on my show over the past about 2.5, 3 years now. So okay, next question. Susan's asking, I'm concerned about the 1050 wavelength, works just as well as the 810. I have, in answer to your question, I have been able to see some folks that have purchased both units, both the Ultimate, which has the 1050 nanometer, and the Ultimate that has the 810 nanometer, and the Super Palm with the 1050. And there's been a couple of occasions where even some doctors who have bought both units have felt that they've seen more of an improvement quicker. We don't have a study of 100 people saying that the 1050 is that much, that much better. I just don't know. But the feedback is positive. And one other thing that the 1050 nanometer is very beneficial to, even if, as you saw, it was almost the same reading coming through my hand, what it is doing is it is getting absorbed by a little bit of the water, and at that wavelength, it's near the area where there's more absorption, and you can actually cause what's called structured water, and that's something that is it's newer as far as the understanding of it. There's still a lot of debate about what it is and what it is not. And apparently it's something that's very beneficial to the cell. Either way, I've seen a lot of people being helped both with either the Ultimate unit or the Super. And that's all I know. Now, as I mentioned earlier, the mini, or at least the mini canopy, that foot square that you see in the back picture here, you can get that model with the 1050 if that's what you'd like. It normally comes with 660, 810, but we do customize it for 660, 1050 nanometer, and that's the same with the helmet, 660, 1050. And I was going to show you, but it's going to take a little too long. But what I have been able to do, it's very interesting. I've been able to put the skull inside here and do measurements of light going through the skull from this unit and applying energy to the to the brain then going through. So it's pretty interesting. Cheryl is asking, I tried to use the PBM on my one dog who had the hindquarter neuropathy. I used the red and near infrared, and I just shorten it up. It's just that the dog was a little spooked with the light, and I know sometimes they got to gain a trust like anything else. At first, they may be very squeamish about hearing the sound, and it just causes them to spook or not like it. But once you try and very gently bring them into the light, and if they start feeling it, I had a big device that I made for horses, and it was one of my older technologies. And what happened was the horse actually first was horses can be very skittish, and it didn't like it very much. But once we just kept petting, well, the trainer was just petting the horse, and the horse started feeling that energy come in. And next thing you know, it was pushing against the thing. I thought it was actually going to destroy my light because it was leaning right against that light. It liked it so much. So it went from being skittish to liking the light. And so I guess I wished I could help you on that one. But it's a case of probably really gently bringing the light over and slowly, another question here by Glenn. We have a rescue dog, Jackie, who has been abused and has scarring on her palms. She licks paws frequently due to the irritations of the scarring. How can the PBM help her? And that's one thing. PBM really does help with over time scarring. Look at it. I'm fading away, guys. It's 15 after, and for some crazy reason, maybe we'll try it again. Maybe it'll work a little better. No, still there we go. I am disappearing. Anyways, we're gonna call it quits in a minute here. So so yes, it can help with the pause. Okay. And Elizabeth's asking, does PBM devices help with getting the lymphatic system flowing better? We got a whole article on PBM and lymphatic. It's on our research page. And I'm going to, I'm very, very thankful. I think I'm going to wrap it up right now. I'm very, very thankful to Dr. Lauren Duke, who was on tonight, Scott Faulkner, Brad Little, and there was others. And I'm just so thankful that they came on because you were able to hear firsthand how the light has been helpful to so many different conditions. So I want to thank everyone for joining us. Please join us next week, Tuesday. Your questions, we will try and answer them. So, we'll try and get back to you as well. You can always ask questions to info@sunpowerled.com. That's sunpowerled.com. info@sunpowerled.com. And also, please remember to invite as many people as you can to this. And as well, remember, there's that competition coming up for the Super Palm for those that help us increase our subscriber base to tell so many people what light can do. So thank you for joining us tonight. I wish you all the best. May you have God's richest blessings, and use a little bit of light for those areas where you need to. Bring light to your pain. All the best. Bye for now.